Anal fissures are a surprisingly common yet often unspoken medical problem that can cause significant pain and distress. Despite their prevalence, they remain a topic few people feel comfortable discussing openly. Because of embarrassment or lack of awareness, many delay seeking medical help, which often worsens the condition. In this detailed guide, we'll explore what anal fissures are, their causes, signs and symptoms, diagnostic methods, treatment options and preventive strategies. By shedding light on this painful but treatable condition, we aim to encourage early recognition and care. An anal fissure is a small tear or cut in the thin lining of the anus, the opening at the end of the digestive tract where stool leaves the body. Although small in size, this tear can cause severe pain and bleeding during bowel movements. Unlike hemorrhoids, swollen blood vessels around the anus, fissures involve a break in the skin. They can occur at any age, from infants to the elderly, but are most common in young adults. Anal fissures are classified into two categories: acute anal fissure, short-term, lasting less than 6 weeks, often heals with conservative measures like dietary changes and sitz baths. Chronic anal fissure persists for more than 6 weeks, may recur frequently or resist simple treatments. Sometimes associated with a visible skin tag or muscle spasm of the anal sphincter. Causes of anal fissure. Anal fissures typically result from trauma or injury to the anal lining. Some common causes include 1. Constipation and hard stools. One of the leading causes, chronic constipation, forces the anal canal to stretch excessively. Passing large, hard stools can tear the delicate lining. 2. Chronic diarrhea. Frequent loose stools can irritate the anal lining, weakening it and making it prone to tears. 3. Straining during bowel movements. Excessive straining, whether due to constipation, pregnancy, or certain habits, creates pressure that damages the anal tissue. 4. Childbirth. Women may develop fissures after vaginal delivery due to increased pressure on the pelvic floor and rectal area. 5. Anal intercourse or trauma. Direct injury can also lead to fissure formation. 6. Underlying medical conditions. Crohn's disease and other inflammatory bowel diseases. Tuberculosis, HIV, syphilis, or cancer of the anal canal, rare but possible. These conditions reduce healing ability and increase susceptibility to fissures. The hallmark of an anal fissure is pain. However, the discomfort is often so severe that people mistakenly assume they have hemorrhoids or another serious condition. 1. Pain during bowel movements. A sharp, burning or tearing pain while passing stool. Pain may last minutes to hours afterward. 2. Bleeding. Bright red blood on toilet paper or streaks on the stool. Usually mild but alarming to patients. 3. Itching or irritation. Persistent fissures may cause pruritus ani, anal itching. 4. Visible tear. In some cases, a small crack or ulcer can be seen at the anal opening. 5. Sentinel pile, skin tag. In chronic fissures, a small skin tag may form near the fissure site. 6. Anxiety about bowel movements. Because of severe pain, people may avoid going to the toilet, which worsens constipation and creates a vicious cycle. While anyone can develop an anal fissure, some factors increase the risk. Chronic constipation or diarrhea. Pregnancy and postpartum period. Low-fiber diet. Sedentary lifestyle. Excessive straining or heavy lifting. Underlying diseases like Crohn's or HIV. Diagnosing an anal fissure is usually straightforward and doesn't require invasive tests. 1. Medical history. Doctors ask about bowel habits, pain patterns, and related symptoms. 2. Physical examination. A visual inspection of the anal area often reveals the fissure. Digital rectal examination may be avoided initially due to pain. 3. Additional tests if needed. Anoscopy or sigmoidoscopy to rule out other causes, hemorrhoids, tumors, Crohn's disease. Blood tests if an underlying infection or inflammatory condition is suspected. Treatment depends on whether the fissure is acute or chronic. The goal is to reduce pain, heal the tear, and prevent recurrence. 1. Conservative management, first-line treatment. Dietary changes. Increase fiber intake, fruits, vegetables, whole grains. Drink 6 to 8 glasses of water daily. Consider fiber supplements like psyllium husk. Stool softeners. Medications e.g. docusate sodium, help prevent straining. Sitz baths. Sitting in warm water for 10 to 15 minutes, several times daily, relieves pain and relaxes the anal sphincter. Topical treatments. Numbing agents, lidocaine, for pain relief. Hydrocortisone creams to reduce inflammation. 2. Medications for chronic or severe cases. Topical vasodilators. Nitroglycerin ointment. Relaxes anal muscles and increases blood flow for healing. Calcium channel blockers. Diltiazem, nifedipine alternative to nitroglycerin with fewer side effects. Botulinum toxin Botox. Injection. Temporarily paralyzes the anal sphincter to promote healing. Success rates up to 80 to 90%. 3. Surgical treatment. When conservative measures fail, surgery may be considered. Lateral internal sphincterotomy, LIS. The gold standard for chronic fissures. Surgeon cuts a small portion of the internal anal sphincter muscle to reduce spasm and pressure. Healing rates over 90%. Risk: rarely minor fecal incontinence. Advancement flap surgery. A tissue flap is used to cover the fissure and improve healing. Reserved for complex cases. Even after successful treatment, fissures can recur. Preventive measures include: maintain regular bowel movements, high-fiber diet and hydration, avoid straining, respond promptly to the urge to pass stool, practice good anal hygiene, gently clean with water or soft wipes, exercise regularly, helps regulate bowel function, manage underlying conditions, treat chronic diarrhea, constipation, or inflammatory bowel disease. The psychological impact of anal fissures is often underestimated. The fear of pain can cause anxiety, embarrassment, and social withdrawal. Seeking medical help early not only prevents complications but also improves quality of life. Remember, anal fissures are common, treatable, and nothing to be ashamed of. Seek medical attention if pain persists for more than a few days, bleeding is heavy or recurrent. Over-the-counter remedies do not provide relief. You have a history of inflammatory bowel disease or other chronic conditions. Conclusion. Anal fissures may be the pain no one talks about, but breaking the silence is essential for timely diagnosis and treatment. While often minor, they can cause severe distress and reduce quality of life if ignored. The good news is that with simple lifestyle changes, medications, or, if necessary, surgery, most fissures heal successfully. Taking preventive steps and seeking medical advice early can save patients from unnecessary suffering. No one should feel embarrassed to discuss such a common health issue with their doctor, because healing starts with a conversation.